Gather my supplies. My supplies for vital signs will be my blood pressure, stethoscope, and various thermometers, alcohol preps, a pad and pen to record my vitals, disinfectant wipes, and 2 barriers. The 2 barriers are for my basket so that when I go into the room, I'll have this to protect this from coming into contact with the resident's environment and possibly spreading it to the other residents when we go to a different room. I will disinfect all of my equipment before time using these disinfectant wipes to save time for the purposes of this video. My hands and gathered my supplies.
Come in.
Hi, Miss Jasa. How are you?
Fine, thank you.
Good. I'm Linda, and I'm your CNA, and I'd like to get your vitals if that's okay.
That's fine.
Oh, that's great. How are you over there, Mrs. Smith? I'm good. Oh, great. I'll be over there to get your vitals in just a moment. So I'm going to put my barrier down here for my basket, because we don't want anything on this table to go with us when we go into the next room. Wash my hands, and then provide privacy. Close my door, and close my curtains. Excuse us for a moment, Mrs. Smith. So how have you been, Miss Jasa?
Fine, thank you.
Great, great. I just want to move some things around if that's okay. Alright, so I've already disinfected the equipment, so I'll just get started. And for the purposes of this training video, I'm going to get all 3 temperatures on you at the same time. So, you know, we would never do that in real life, right? We would just use only one route to get your temperature, okay? That's okay? All right, Miss Jasa. Let's get started. So, to get vital signs, I really don't need to wear gloves, but if anyone thinks that there's a chance of coming into contact with someone's body fluids, then by all means, always operate on the side of safety. But I think I can do this without wearing gloves, okay? So for our thermometer, this is an oral thermometer. This is a glass thermometer, and not many facilities, as a matter of fact, I don't know of any facility that uses a glass thermometer. But because the state tells us we have to teach you this, I will be getting a glass of oral temperature using the glass thermometer. Now we have to make sure that the blue center column is below 96, and if it's not, then we would have to shake it down using a flicking of the wrist action to bring that fluid down below 96. And then we clean our thermometer. I just wanted, even though I said everything was clean, I just want to do this one just to demonstrate. So I just open up my alcohol prep and then just encircle it and then twist the thermometer so that I'm cleaning all the way down the stem. There. Now I'm ready to put on a protective sheet or a probe cover. We don't use thermometers without using probe covers. All right, Jason, this will go to the back of your mouth, along the heat pockets, where the heat pockets are, up underneath your tongue. We're going to leave this in your mouth for 3 minutes. So just close your mouth and let your lips hold the thermometer in place, because you're alert and you can do that, okay? All right. And at the same time, I'm going to use a digital thermometer to get your axillary temperature, which is up underneath your armpits. So again, even though I said I cleaned the equipment, I just want to do this to kind of demonstrate. Okay, open this up. There. You like it warm in here, don't you? Mm-hmm. Turn it on. Okay. Put the protective sheath cover on, or probe cover. And we're going to place this right in that little pocket of your armpit. So can I, that's without exposing you here. There, okay, you can put your arm down. Okay, it beeped already, so good. It's done. There. And we always clean our equipment before and after use. That is infection control, a very important infection control principle. And remember, another word for infection control is medical asepsis. So we clean our equipment. We have about a minute and a half left for your oral one. While we're waiting on that, let's do your tympanic temperature using our tympanic thermometer. So again, clean our equipment before and after use. Put on a probe cover, and for this one, we have it in a little box like this. We just kind of peel back the side and then insert it into the little box. And now the probe cover is stuck on the tip. Turn it on. To get a tympanic temperature through your ear, we gently pull up on your ear and to the back, okay? To straighten out that ear canal. Tuck it in your ear and just kind of scoop it and then press the start button. Okay, Miss Jasa, very good. So again, clean our equipment always before and after use. Now, even though we are, for at least my students, we did 3 different types of temperature, but I just want you to choose one reading and record that. So it's been 3 minutes now. Okay, Miss Jasa, very good. And clean our equipment. There. All right, so put this back in the cover. Okay, now I need to get your pulse, okay? All right, you have your hand, and just relax. Relax. And I'll get your pulse. Now I'm not looking at the clock. I'm trying to look away from the clock. Once I got my starting point and timing your pulse, I'll look away so I'm not counting the ticks of the clock. Sometimes the clock can throw us off. The ticks of the clock can throw us off. And I can always tell when people have counted the ticks instead of the actual pulse is when I get pulse rates of 60. I'm very, very suspicious. Okay? So for 1 full minute, I'm counting your pulse rate. In nursing homes, many of the residents have an irregular heartbeat, and we don't want to get any abnormal results because we're trying to just count for 30 seconds. Now, after I've obtained your pulse rate, now I'm looking down at your chest or some type of movement in your upper body so that I can catch your, count your respirations. I would never tell you this because you would change your breathing pattern. So after getting the pulse, I just glance down at the abdominal area, chest wall. I can look in the back, on the sides, any place for chest movement, and I'm counting for 1 full minute. As I leave my hand here on your pulse side, I want the resident to think that I'm still getting their pulse rate, but what I'm really getting is their respiratory rate, so they don't change their breathing pattern. Okay, a minute later, we're done. Okay, Miss Jasa. Let's record your vitals. And last but not least, we want to get your blood pressure. So to do this, I'm going to make sure that your arm is at the level of your heart. So I'm going to use this pillow. And if given a choice, I want to use your left arm because it's on this side where you get most of the force of the heart when it beats. So I'm going to have you slide down a little bit so I can get this table up underneath the bed. And can you rest your arm on there, this pillow. I've already cleaned my blood pressure cuff, so I'm going to go ahead and apply it. And best practice is best to just put the blood pressure cuff on bare skin. but her shirt is so thin that I think I can still hear it and get an accurate blood pressure through this thin shirt. So let's make sure we have the right size for you. So small. Okay, yes, and the white does fit within the little arrows. Maybe just a little big, but there we go. There. I'm going to demonstrate the one-step and the two-step method of estimating a blood pressure. We always want to estimate the blood pressure so that we do not overinflate the cuff, causing pain, discomfort to the resident. I don't know if you guys have ever been to a doctor's office and they automatically inflate the cuff to 200 and then your blood pressure is only like 100 over 60 or something. That's overinflating. That can cause bruising to the resident and pain. When you're cleaning your stethoscope, you always want to clean the earpieces with one alcohol prep, and then the diaphragm, the part that we're going to be listening through when we're getting their blood pressure, with another alcohol prep. Okay, Miss Jasa, I want to do the two-step method first. In order to do that, I don't know if you can get a clear picture of this, but can you see, Will? Come closer. Because I want you to actually be able to see the dial. So you might have to, because the pillow's in the way. I'm going to move this out of the way so you can get a closer shot. Can you come around this way? Okay, to do the two-step method, I'm going to find your radial pulse, and the radial pulse is always going to be on the same side as your thumb, down here in the grooves, so right there. So I'll place my hand over the radial pulse side, and then turn the valve to the right to tighten it up so we can inflate the cuff. I'm going to slowly inflate the cuff until I don't feel her pulse anymore. And look how slowly that needle is rising. You don't want big jumps. It has to be nice and smooth. So we'll say 110 is where I last felt your pulse. Then I will add 30 to 110, and I'm going to inflate the cuff to 140. Okay? Alright, so give your hands a moment to allow the blood to return. Okay. Now I'm going to find your radial pulse, and your brachial pulse, and because you have a shirt, I'm just going to show you on me. So if I were to draw a line down the center of my arm, the brachial pulse will be found just slightly off center on the inside part of the arm, the side that's closer to the body. So the brachial pulse will be found right there. So now I'm ready to get her blood pressure. Now that I have an idea of how high I want to inflate the blood pressure cuff, find her brachial pulse, which is right there. Place my diaphragm over the brachial pulse. Put my earpieces in my ear. And then anchor this diaphragm onto the arm. You can relax. So that, anchor it in a way so that I'm not picking up the artifact from the movement of my hands, my fingers. So quickly inflate it to 140. And then slowly deflate the cuff until I hear the first two sounds. Okay, Miss Jasa. So that was the two-step method. To do the one-step method, I will just omit this part here. I'm actually just going to put the stethoscope over the brachial pulse, like so. And then I'm going to slowly inflate the cuff, listening until I don't hear her heart beating anymore. And then quickly inflate the cuff 30 more points. So, again, as I said, slowly inflate the cuff. Let that needle rise very slowly. Listening. Relax. And then inflating the cuff 30 more points, so we'll inflate it to like 130. And then slowly deflate, listening for the first sound. So the first sound that I hear is the systolic. The very last sound that I hear, no matter how faint it is the diastolic. Okay, Miss Jason. And of course, disinfect our equipment after use. So for the purposes of this video, I'm just saying we've disinfected it. Alright, I'm going to put those back in the basket. And I'll at least demonstrate disinfecting my stethoscope using an alcohol prep for the earpieces and a separate alcohol prep for the diaphragm. There. Miss Jason, is there anything else that I can do for you?
No, thank you.
Okay. Record your blood pressure. Alright, and put it back into the basket. I can move this out of your way for you. Put your pillow back on your bed. Tidy up. Make sure everything is nice and neat. There. Your call light is within reach there for you. Put your personal items back on the table. And let's see, brakes are still on. I'll open up your curtains. Mrs. Smith, is there anything that I can do for you? All right, well, if there's nothing else, how about you, Jason? Yeah. Well, if there's nothing else, then I'll just sanitize my hands. Pick up my basket. Throw away the barrier. And leave. Now, I want to show you a difference. This is what some students will do. They will, because they're so prone to know that we have to sanitize our hands before we come out of the room. This is what they do, which is an error. They will pick up the basket, throw the barrier away, realize that they have not sanitized their hands yet. They set it back on the contaminated table to sanitize their hands and then pick up the basket and leave. So you can clearly see how that's wrong. We've just recontaminated the basket. So that's why we do it like this. Again, repeating. Sanitize my hands, pick up the basket, throw the barrier away, because this side is the clean side. This side that was touching the table is the dirty side. Throw it away. All right, Mrs. Jason, I will see you in 2 hours when I do my rounds.
Thank you.
Okay, thank you.